I just realized that it's just insidious. It's just a side effect.
Yep.
The suicidal ideation is just a side effect of the bipolar condition. It just erupts. It appears.
Right.
Whether you were thinking of it one day or not, all of a sudden you feel suicidal.
And some people, it's just such an impulse. They think it, they act.
Mm-hmm.
Another, I mentioned Robin Williams. Another one, if people know, I don't know if you know Twitch. Have you heard of Twitch?
Mm-mm.
So Twitch is a very popular dancer. He was on the show So You Think You Can Dance. He was on Ellen DeGeneres' show when she had one.
Mm-hmm.
But here's the guy dancing, smiling, happy. And one evening he had a wife and 2 young kids.
Mm-hmm.
And one evening he left, and he just walked out of the home, and his wife eventually called the police because this is not like him. He didn't bring his car. And he ended up going to a hotel and checking into a hotel and hanging himself in the hotel room. And people just like, doesn't make any sense.
Yeah.
This makes no sense. And people, people with, and again, suicide is obviously the worst outcome of mental health. There's no reversing that. So people, get confused by that because, Robin Williams, Twitch, and a lot of people, super successful, have everything you would want in life, rich, everything, famous. And people are like, well, why would that person have anxiety? Why would that person be depressed? Why would that person feel suicidal? They have everything. So people try to make sense of these things. You can't make sense out of these things because no matter how good someone has it, those are just things. When you feel inside is what matters. And that's, and so it's really sad. Thankfully, I haven't rarely seen that in my practice, which is great, but it's way too common. It's gotten worse over recent years too. Since the pandemic, it's gotten worse, a lot worse.
Yeah, the pandemic.
So, but anyway, so moving on. Sorry, it's a depressing topic, but I think it's important to talk about it because it's very misunderstood, and if you can get the message that. That person know that they do not decrease suicidal thinking. They decrease it, especially if the diagnosis is correct, and especially if you medicate properly. Suicidal ideation is a problem with not treating things. When you treat things properly, that goes away, and that's extremely important. So anyway, going back to what you were saying, so anything else you'd like to share with us? I mean, you have a great story of what you've done and how long you've been sober. That's truly amazing.
Mm-hmm. I don't think I would have stayed sober this long if I hadn't treated the bipolar condition at all.
Right.
Yeah. I mean, I've had different things I've struggled with.
Mm-hmm.
Different compulsive behaviors, shopping, different things like that. But, different addictive behaviors, I think because I have an addictive personality, but nothing earth-shattering.
Right. You're right. I mean, there's going to be some residual stuff. The shopping is a common, I had mentioned before another show about smoking.
Yeah, smoking.
A lot of people in the program, in the AA, smoke cigarettes.
Yeah, I don't,
I call cross addiction means you've given up the alcohol, but now you're doing other things. Yeah. It could be gambling, it could be shopping, it could be high-risk sports.
Yeah.
It could be mega doses of caffeine. I mean, some people drink I don't know how many power drinks a day, and they just. But the problem is, you do that much caffeine and stimulants, it's just going to make everything worse. And so there's a lot of self-medicating. There's a lot of cross addiction out there going on that needs to be addressed. Obviously. Yeah. So.
But nothing earth-shattering. I mean, that's really, I mean, I don't even know if I could call it an addiction. It's, like a hobby or whatever. It's nothing earth shattering.
Right, exactly. I've known you for quite a while, and you've done actually really, really well.
But I've had a lot of help,
Yeah.
But I think that's the main thing to do is, I think, the hardest thing is to ask for help and to get the help that you need. I think that's the most important thing is asking for help and getting over the stigma of the bipolar condition or being manic depressive, that it's not the end of the world, and that there is hope and there's a lot of good treatment out there. And if it's not working with the doctor that you're with, is to seek out the right professional help and get the help that you need, but get help, and it's not the end of the world, and you can live a happy and a successful life and have peace of mind and have, a very full and fulfilling life. But it's really important to ask for help and get help and not to give up. And you cannot go untreated with this disease. You cannot. And you cannot do it.
If you want to live, you're right.
You cannot do it with, organic or, placebo, whatever, supplements and CBD or whatever. You have to do it with professional guidance. And I can't stress that enough. I wish I could say, I've done this chemical free and you don't need to take medication, but I can't emphasize enough how important it is to take the appropriate medication and to have professional guidance and to follow it and follow direction and do what you're instructed to do. It's really important because I know there's been times with Dr. Corona that Dr. Corona has suggested to me, I think maybe you should go up a little here or take a little out, add a little in. And I said, no. And then honestly, years down the road, I've done it. And I think, why didn't I do that when he suggested that 5 years ago? I mean, just recently, like with the Geodon, I know many years ago you said, why don't you go up on the Geodon? And I remember saying no years ago. and just recently in this last 12 months, I've gone up on my Geodon, and it's made a tremendous difference for me. And I know that Dr. Corona suggested it many years ago, and I probably could have been a lot more comfortable years ago. So, it's really important to follow directions. So.
I can't say anything better than what you just said. You're absolutely right. And in the message that medications are not your enemy; they're your friend. And I think people, when you deal with addiction, you paint a broad brush and say, well, I don't want to be on anything.
Right.
But they'll be on supplements, they'll be on this and that and vitamins and whatever, CBD. They'll do that. They'll do psilocybin. They'll do whatever. And again, not the, that can work for some people with depression. It doesn't work for bipolar. But I think the message that, trying to say what's the difference? If I'm going to be on medications for a while, how is that not addiction? Well, again, it's not addiction. It's treating a medical problem. And if you don't treat the medical problem, it's gonna come back to bite you. But thankfully with you, you hung in there. And even, Lisa now, she does things on her own. She's at the point where she knows what to do when. She knows when to increase the Wellbutrin. She knows when to up or down the Geodon. You do it without even asking me because you.
But I do check it out with you.
Yeah, you do check it out.
I do check it out with you.
But you seem to pretty much most of the time make the right decision.
Well, I do check it out with you though. I may do it, but I do. There is a phone call involved at some point. There is a phone call or a check-in, or I let you know what I'm doing and. It's always usually something that we've discussed at some point that I'm doing. I don't totally go off the reservation. But it's usually something that's what we've been doing. And I have to just add one more thing, that if you are a sober alcoholic or drug addict, oftentimes people in the program will say, you're not sober or you're not clean if you're taking medication. No. And that is just not true.
Another pet peeve.
If you have a bipolar condition or a depressive condition, Being treated with this kind of medication, if it was that great, people would be selling it on the street, and they're not, because I do not get high on this medication. I do not take it because it's mind or, mood altering or what have you. It's simply not that kind of a medication. It's a treatment for me.
I talked to a patient earlier today who's on a few things, and he's very active in AA also, and he says that occasionally he'll hear this, like, "Oh, you're on medication, you're not." And he goes, "Look," he said, "Are you an MD? Where do you get your PhD?" "No, I didn't get it." "Okay, well, why are you giving me medical advice then?" "Well, I'm not. I'm just saying." So, no, he said, "This works for me. It keeps me sober. These are not the same thing." So basically, there's a lot of that attitude, out there, even in the program, because people think, well, I've been sober this long and I haven't taken anything. Well, good for you. That's great, but that's not everybody, and so it's a dangerous message also, because if people don't take the proper medications, then it can lead to suicide's the worst outcome. What's the second worst outcome? Living miserably, living with a disease that's treatable that you don't treat, and that you just feel miserable all the time.
Yes.
And you just and do you want to live that? Do you really want to live that way? So. Yeah. Well, thank you so much for coming in, Lisa. I really appreciate it. You've been again a couple decades of seeing you back in my old office even, and
sick of seeing me.
So. But yeah, I appreciate you coming in. And,
okay.
All right. And thanks. Thank you so much.
Thank you, Dr. Garner.
Good to see you.
Thank you.
All right. So in Lisa's case, she's got bipolar 1 disorder. Now, this is the toughest condition, short of schizophrenia, which is the toughest, but bipolar 1 is second toughest. It's a tough condition because she's got a lot going on in the brain. The main focus typically is dopamine. And so the problem there's a dopamine imbalance. That's why Prozac or Zoloft didn't work for her. That's why she wouldn't do well on a typical antidepressant. So she's on a combination of Seroquel. We call it atypical antipsychotic. Why Seroquel? It's really amazing for sleep. And if you recall what she said about I couldn't shut my brain down, Seroquel is basically it's going too fast, so it dampens it down, it slows down, and we call it dopamine antagonist. The problem is with Seroquel, if we try to get it high enough to treat the bipolar 1, 300 milligrams is not going to typically be enough. You need to get that up to like 600-800 milligrams, sometimes 900 milligram range. So that's why she's also on Geodon, which is not sedating. And so she's on a combination of two. Now, is that controversial? Some doctors might think, oh, that's too much. Why are you putting her on two different ones in the same class? Because they both work and they work together. So I have a lot of the more difficult patients on a combination of a couple things like that. The other one with her is GABA, which is where Topamax works, and that gets Topamax flowing better, and that reduces anxiety, it reduces pain. And lastly, Wellbutrin. So the thing is, we can slow down dopamine, but the problem is at that point, the person's going to not be manic and not be psychotic, but it's going to be depressed. So Wellbutrin really focuses mostly on dopamine, a little bit norepinephrine, but it's mostly dopamine, and it speeds it up. I call this balancing dopamine 24/7, and I talk about this in my books. The Wellbutrin does it in the daytime, but if you do only Wellbutrin, then they're not going to sleep. They're going to still be manic. If you just do only these, but then you don't do the Wellbutrin, then they're going to be tired and depressed. So in Lisa's case, and a lot of times it takes a low dose of an antidepressant, but in her case, she's on an average dose of Wellbutrin 300. The lowest is 150, which is often enough, but not in her case. And she actually occasionally goes up to 450. So when she gets a dip of depression, she just adds another 150 in. And she said she only does that for a couple days or so, gets her out of it, and then takes it away. Because if she stays at 450 too long, then she might get anxious and agitated a little bit. Because Wellbutrin can do that if it's too much. But she's figured out over time how to do it and how to change. So she changes the Geodon when she needs to. She changes the Wellbutrin. Because I've really empowered her to do that. And because she knows, she can tell at this point with her body what she needs. So she's been very successful doing things on her own. She'll check in with me and run things by me, but in her case, she's figured it out, and she's doing really well. I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of the Dr. Paul Show.